Nipah scare has returned to haunt Kerala. This time, it's not just the virus, it's the uncertainty, the long wait and the fear of what may unfold next. Now to the numbers. The state's contact list has now expanded to 485 individuals. Health Minister of Kerala, Veena George, confirmed that Malappuram has become the epicentre of this fresh scare with 192 contacts which have been traced. Now, of these, 18 are under treatment and 1 remains critical. Still, some relief comes with 42 samples which have tested negative. Next, let's take a look at Palakkad, reporting 176 contacts with 3 under isolation and 7 negative results returned so far. Now, in Kozhikode, 114 contacts have been identified, though no confirmed cases as yet. In Ernakulam, 2 cases of contacts have been reported, and Kannur, 1. And to know what's really the status is so far as Nipah is concerned, let me now go across to Vivek Narayanan, my colleague who is reporting live from Thiruvananthapuram. Vivek, what is the status even as we speak? Because one thing about Kerala is that they do continuous testing, Vivek. So a lot of other states may think that why is it that Nipah keeps returning to Kerala? I think that's an anomaly, that's a misnomer, that's a myth which needs to be exploded because Kerala does maximum testing. However, Nipah cases have unfolded in Kerala. Over to you for the latest on this, Vivek.
Yes, of the latest information as far as I'm getting from the health department is that there are 2 confirmed cases of Nipah that has been reported in the last 1 week, of which one person, that's a 39-year-old woman from Palakkad, is in a critical condition and is in ICU in ventilator support. Now, as far as the contacts are concerned, there are 485 contacts, as you just said right now, of which 192 are from Malappuram. The rest are from 170 from Palakkad and 119 from Kozhikode, 2 are from Ernakulam and 1 from Kannur. Now, here we need to understand that there is a research team which is visiting each and every houses which where these Nipah contact cases has been raised, and also places where the Nipah positive cases has been reported earlier. Remember, in 2018, 17 people have lost their life to Nipah, and after that, we saw three people losing their life in 2021. And every year, at least 1 or 2 deaths related to Nipah has been reported, and precisely it's happening in Kozhikode, Malappuram area. Now, what is even more worrying at this point of time is that even those people, those individuals who have suffered Nipah, who have who have been tested positive and managed to be tested positive once and then later came out of this trauma, are facing a lot of neurological damages, physical damages, mental issues. And there are 2 specific cases in Kerala. One is a person who's been in Mangalore for quite some time, and the other person is from Palakkad. The first person is 24-year-old, and the other person is 39-year-old. Now, both are facing neurological damages, and also they are in a coma state, and they are facing a lot of issues, health issues. They're not in a position to even wake up and even speak to their near and dear ones. So
Yeah.
this is something which is very, very
Absolutely,
concerning
and that's what
as far as
exactly what we are going to discuss right now, Vivek. As told by you, that is slightly kind of an anomaly, if I may add, these 2 cases which have come to the fore. Of course, Vivek, you and I, we both assure News9 viewers that there is no need for panic, just enough care and precaution needs to be taken. If one does that, then one keeps away from Nipah. As of now, thank you very much, Vivek, for joining us on this broadcast. And now to a deeply distressing report from Kerala, exactly what my colleague Vivek Narayan was speaking about. Months after being declared virus-free, 2 Nipah survivors remain trapped in a state of coma, raising alarm over the long-term impact of the deadly virus. They were once called survivors. They were celebrated. I mean, I'm a survivor of COVID. I'm sure a lot of viewers are also survivors, So therefore, please, this is not an intent to create panic, but just so that one knows what are the repercussions, what is the aftermath of Nipah, as it were. Now, both these individuals now lie unresponsive, caught in what doctors call a persistent vegetative state. Their bodies are alive, but their minds have shut down. Take the case of 25-year-old Tito Joseph, a nurse, a male nurse from Mengaluru, who contracted the virus in August of 2023 while caring for a patient in Kozhikode. Now, Tito tested negative in September and was discharged after recovery. But weeks later, Tito developed neurological symptoms and eventually slipped into coma. It's now been 19 months and he hasn't opened his eyes ever since. Yet another case of a 39-year-old, some say she's 42, but she's a woman, nevertheless from Malappuram, infected during the May 2025 outbreak. She follows a similar haunting path, much like Tito. Despite being declared virus-free after hospital treatment, this woman also slipped into a vegetative state and remains on supportive care and at home. Doctors say that even after the virus clears, it can in some cases leave lasting, devastating impact on the brain. In rare cases, post-infectious encephalitis or direct brain damage could result in prolonged unconsciousness, turning survival into a very painful, uncertain waiting game for both the person who's suffering as well as the families. With the Malabar region still reeling from repeated outbreaks, the Kerala government, in coordination with the WHO, is now working on a Nipah specific recovery framework. But you know, for families like Tito's and also the other woman, every day is about hope that maybe today they will open their eyes. Let me now go across to the experts. Dr. Ishwar Gilada, Consultant Infectious Diseases and Secretary General, People's Health Organizations, and Dr. Sudhir Kumar, Senior Consultant Neurologist, Apollo Hospitals. A very, very warm welcome to both of you. Dr. Gilada, this is supposed to be one of the rarest of rare cases, what I have read, that this was unheard of, Dr. Gilada. No one ever heard of this. Tell me something, this kind of impact on the brain, and of course, I'll go to the neurologist later. How does one explain this? Because in both these cases, particularly Tito, at least in the case of, let's say, 39, 40-year-old, we can say she's slightly middle-aged, right? But this is a 25-year-old, Dr. Gilada. What may have gone wrong, sir?
See, thank you very much, Sudha, for having me on the show.
Pleasure, sir.
Despite having a lot of research and development, overcoming a lot of issues, infections, medical profession still has to believe in God. Only atheists will not believe God. We don't know what is the condition, why the particular person is suffering. But however, when we talk about coma, it is a continuous state of unconsciousness. It can happen because of trauma, hemorrhage. It can happen in diabetic. It can happen because of some mental trauma also, because you're talking about a nurse. There was a female nurse in Mumbai. She was raped by a ward boy in 1973, and she survived for 42 years, but always remained in coma. So this kind of situation where it is not hope, it is also despair. So it's a mix of hope and despair. Medical profession believes in that the chances may be least, we'll do our best. But at the same time, at some point of time, we must give up. And we here again we'll have to start a debate like euthanasia, whether there can be a passive euthanasia, whether there can be kind of mercy killing in such cases where nothing can be done, and it is a vegetative state for the patient, burden for the hospital.
Wait, Dr. Gilada, sorry to interject. If I get the virus and I'm virus free, I am considered to be in the safe zone, safety zone. You'll send me back home if I'm in your hospital. You'll say discharge slip, let's sign it, so that go home. This happens after they have tested positive.
COVID, similarly long Nipah.
He was, sir, in Tito's case, you're a doc, sir, I'm asking you, in Tito's case, sir, in Tito's case, Dr. Gilada, I humbly submit that he had very mild fever, he was talking, he was walking, you know, COVID mild, which asymptomatic, which I also got. I was doing everything, I was isolated. The point of the matter is that what does one do when one has tested positive and said you can go home and then this happens? Let me go to, I'll come back to you, let me get in Dr. Sudhir Kumar. Doctor, I want to ask you, Dr. Sudhir Kumar, is that, don't you think, you know, Dr. Gilada says, by what I mean, Dr. Gilada is very celebrated as a doctor, but I just think that we're still looking for answers here as to what may have gone wrong. There are two cases, sir. This is how diseases are, after all, epidemics, you know, your fraternity finds out. Now, the thing is that they were given, both of them, when does coma happen? When there is some swelling? I'm not a doctor, but little bit that one knows. You know, that is the only point. Do you mean to say that this Nipah virus must have created some brain damage for both patients to present themselves with coma-like situation and then slip into coma, Dr. Sudhir Kumar?
Yeah, thank you, Sudhaji. A very important topic you have brought out today. It matters a lot. So basically, if you look at Nipah virus infection, usually it's a respiratory infection in most people. So they come with either no symptoms or minimal symptoms like fever, headache, body ache, cough, and mild breathing difficulty, and they recover. But a small number of people with Nipah virus do get what is called encephalitis, where the virus enters the brain and causes brain infection. And when encephalitis happens due to Nipah virus, then symptoms can be seizures, coma, and sometimes focal deficits, like they can get weakness. And then and as I said, there is no specific treatment for Nipah virus infection. So treatment is mainly supportive. So if somebody has seizures, we give anti-seizure medications. If there is brain swelling, there are medications to reduce the brain swelling. Some patients' respiratory center may be affected, so they require ventilation. So all these things in the acute phase.
Yeah, right,
Now,
sir.
Nipah virus encephalitis has a high death rate. Almost 40 to 70% people may die. But those who survive with Nipah virus encephalitis, a small number of them go into this kind of state, what you correctly mentioned as persistent vegetative state.
No, but
Now,
Dr. Sudhir Kumar, yes, you are absolutely, I've been reading encephalitis or respiratory, distress, if that happens. Suppose there is nothing in the patient, much like what Dr. Gilada says. He said we have to believe in certain things ki dawa nahi to dua se kaam chalaye. I am asking you, what do you do in such a case, sir? Then don't you think there is something mysterious which has happened? What, there has been a silent encephalitis which has had a relapse, Dr. Sudhir Kumar? You're the doc, I am not. So once again.
No, what happens in Nipah virus and many viruses is that the virus may remain dormant and it can again get reactivated and cause delayed encephalitis. And second thing, what can happen after virus, our body has immune system. So they can be post-infectious immune response, what we call as demyelination or autoimmune encephalitis also can happen, which can again damage the brain. So in some cases, what happens is the brain stem part is not damaged and only the cortex gets damaged. So for them, they don't require ventilation. So their breathing is good, their heart rate is good, and they appear awake because they have normal sleep-wake cycle, but they have no consciousness. So which means they don't respond to any verbal commands.
I'm going to ask both of you, Dr. Gilada, let me come back to you, Dr. Sudhir. Dr. Gilada, what is the way out, sir? I mean, imagine it's a Nipah virus, people survive, go back to work, but what is the way out for these two patients? For anyone who's watching this show, what is that sign when we have to say, all right, this is now alarming signals?
No, you see, neurologists are the best people to understand this. But however, as a doctor, I can say that once somebody is not recovering for months and months, then as a medical profession, we will keep on doing, but we give up. Because we have tried everything, whatever best medicines are there, we have tried steroid, we have tried antivirals, we have tried monoclonal antibodies, everything has been done. Now, in such situation, if something is outside the body, you can see. If something is in the intestine, you can go and do a scopy and understand what is there. In brain, you cannot do anything. You have to just wait and watch. Only miracle can bring those people to out. But most of the cases, 99% chances that they may not come out. So in that circumstances, number one, we need to understand that certain things are beyond medical understanding. Whether it's a long COVID, people dying of long after 5 years because of COVID infection at one point of time, or Nipah or any viral infection. Secondly, as Dr. Sudhir Kumar said, there can be immune reconstitution. So it is something called immune reconstitution inflammatory syndrome, which we see in HIV, we see in many other diseases, where everything is settled, but something happened, whether immunity has gone down or gone up, and that infection flares up. So we do not know, but in this case, they are Nipah negative. So in this case, infection has not happened, but immune reconstitution has happened. Yeah.
It seems a mystery, even to someone as senior as Dr. Gilada. Dr. Sudhir Kumar, what Dr. Gilada was saying, let me also, before I let both of you go, this lady who's 39 or 40 years old, she's received 2 doses of monoclonal antibodies and other critical medicines also by the state of Kerala, they've given it to her. She's okay, but she's in coma. Now, how do you explain this? That she's okay, physiologically, she's okay, but she's in a state of coma. What does this mean? Will they ever come out, Dr. Sudhir Kumar, both Tito as well as this lady? Is there any hope? Because like I said, all medicines have been given. They are free of Nipah.
Yes, as you correctly pointed out, so here definitely it's a state of persistent vegetative state. When somebody remains in this kind of coma where they seem awake but they don't respond, and if it lasts for 3 months or longer, then generally they do not come out of this. So, and this is not only unique to Nipah virus encephalitis, it can happen after severe head injuries and also other encephalitis. So the time limit, what we normally say is 3 months. So if those who have to recover or regain their brain functions, it usually happens in 3 months. If 3 months have passed, then the chances of brain recovery is almost nil. But if the nursing care and good nutritional support is given, they can survive for years together. Like Dr. Gilada also mentioned one case where a nurse, she survived for more than 40 years. So survival is there, but that is not of any meaningful life because they don't respond to any stimulus, and all their needs have to be taken care of by caregivers.